Having a penis which is curved over 30 degrees may be a big problem for you and for future sexual life. Hello everyone, this is Dr. Yashar Basha. I am consultant andrologist from Istanbul. Today I would like to talk about the congenital penile curvature and the treatment options. As I promised to you, we will start a penile aesthetic series. This is the first video of the penile aesthetic series, which is related with the congenital penile curvature. What is congenital penile curvature? As you all know, nearly many of men has some kind of penile curvature. Not always penis is just a straight organ. When you look from profile or from upwards, you can see some curvature in your penis. Generally, they are lefties, but when you look from the profile to the penis, generally it is just like U-shaped upward curvatures are common. But when a man has curvature over 30 degrees, starting from their sexual life, when they realized from the first erection, and it's over 30 degrees, it may cause some problems. Because when you go into sexual intercourse, the starting point of the curvature have some pressure on it. Because we don't like pressure on sexual intercourse, because there is a phenomenon, disease, which is called Peyronie's disease, and Peyronie's disease is the inflammation of the tunica albuginea, which is covering layer of the erectile bodies, erectile tissues of the penis. As you all know, penis has two parts, the right corpus cavernosum, the erectile tissue, and the left corpus cavernosum. The spongy tissue is covered with an organ which is called tunica albuginea, which is an elastic organ and gives rigidity and the elasticity of the penis. And if there is an formation, a longer formation of the tunica albuginea on the right side or on the left side, your penis will bend to the other side. For example, for the man who has congenital curvature, the right corpus cavernosum, for example, is longer than the left one, so there will be a left curvature, just like a balloon, and men will be suffering from the curvature. To treat penile curvature, we just measure the angle of the curvature. Because the angle of the curvature is over 30 degrees, the problems will start with the man, because it may cause some pain during sexual intercourse to you or to your partner, or as I mentioned before, there may be some problems, some fibrosis and injuries in the penis from the joint point of the curvature. And there are some problems to have good positions, because some curvatures are to the downwards, and if you have an N-shaped downward curvature, there may be problems to find a good position during sexual intercourse. The only treatment for the congenital penile curvature is the surgical treatment. In surgical treatment, there are some techniques, the Nesbitt technique, which we take out some tunica albuginea and stitch it again, or we can do plication surgery. But I don't like plication surgery, because during plication surgery there is some risk of recurrence after the surgery. The Nesbitt surgery is better control for the recurrence risk after the curvature surgery. If you have penile curvature, you have to be sure about that. One of your corpus cavernosum is longer than the other one. Generally, the average penile length of the male who has curvature is longer than the others. So the main concern about surgery for our patients is the loss of size after the surgical treatment. I all tell to my patients before surgical treatment that there may be some loss in your penis. When you measure it with a ruler, you will lose some size. But for functional penis size, because you have to understand it that functionally it will be the same. You are using, just for example, the left corpus cavernosum and the right one is longer than that. You will have the length of the left cylinder, and we will equalize both cylinders in the size of the left cylinder, and you will not lose any length functionally. But if you are trying to measure it from starting point to the tip of penis, then you can have some loss of size after the curvature surgery. But it's important to have a straight penis, because if there is any curvature, as I mentioned, there may be some sexual problems, just like development of Peyronie's disease due to trauma, chronic trauma to your penis, and you may have some pain, you may have some problems going into sexual intercourse, and it will cause a future problem for your case. Some men have some concerns about appearance of their penis due to a curvature, and if they don't have enough curvature, for example, if it's less than 30 degrees, again, it can be operated to have a straight erection, because we know that the appearance of the penis is really very important for men and for their self-confidence. If it impairs your self-confidence, and even less than 30 degrees, it can be operated. But I don't recommend men who has less than 30 degrees to get operated with the penile curvature, but it's over 30 degrees. Please be careful about to think that you may have some future problems with the penile curvature. If you have penile curvature, if you think of getting surgery, if you think of getting a straight penis, please contact my team and learn much more about treatment options.